strengthened your heart by formula of 80. 1. Control your lower blood pressure under 80 mmHg. 2. Control your pulse rate below 80 per minute. 3. Control your fasting blood sugar below 80 mg. 4. Keep your abdominal circumference below 80 centimeters. 5. Control your bad cholesterol less than 80 mg. 6. Walk 80 steps/minute, 80 minutes. 7. Eat 80 guineas or 80 milliliter food. 8. Do 80 cycles of pranayama. Day. Avoid alcohol, but if one does, do not consume more than 80 ml in a day. 10. Avoid noise less than 80 decibel. Research suggested. In routine checkup, just go for arterial scan, which is non-invasive to find out whether we are suffered from any blocks. No need to do angiography. If blocks found below 80%, go for McLeod medicinal course for 3 months. No need for surgery. Dr. Sanjay, 93232758869, prevention cardiologist.
About chronic kidney disease, CKD, your kidneys do many important jobs. Some of the ways they keep your whole body in balance include removing natural waste products and extra water from your body, helping make red blood cells, balancing important minerals in your body, helping maintain your blood pressure, keep your bones healthy. Chronic kidney disease, CKD, is when the kidneys have become damaged over time for at least 3 months and have a hard time doing all their important jobs. CKD also increases the risk of other health problems like heart disease and stroke. Developing CKD is usually a very slow process with very few symptoms at first. Besides treatment and precautions, other ways to lower kidney disease risk. 1. Lipid droplets help to protect kidney cells damage. LDs store excess fat away from the rest of the cell, which may help protect kidney cells from damage caused by a high-fat diet. Protecting mitochondria, LDs sequester fatty acids to prevent an abnormal flux of FAs into acylcarnitine, which can be toxic to mitochondria. 2. Cadmium accumulates in the kidneys and liver, and the maximum tolerable level of cadmium in the kidneys is 50 micrograms per gram of wet weight. This level corresponds to a urinary cadmium excretion of 2 micrograms per day. These studies have found that even very low levels of cadmium may have adverse effects on the kidney. It is necessary to see cadmium levels in kidney failure. 3. Coffee is generally safe to drink in moderation for people with chronic kidney disease, CKD. In fact, drinking coffee may be associated with a lower risk of developing CKD. Studies have found that people who drink coffee have a lower risk of developing CKD, and the risk decreases with each additional cup of coffee consumed per day. Coffee drinkers have a lower risk of developing end-stage kidney disease. Risk of albuminuria. Coffee drinkers have a lower risk of albuminuria. Coffee drinkers have a lower risk of death related to CKD. 4. Eating oily fish linked to lower risk of kidney disease. A study published in the BMJ found that higher levels of omega-3 fatty acids in seafood were associated with a lower risk of chronic kidney disease. Eating at least 2 portions of oily fish, like sardines, mackerel, or herrings per week may also help. Omega-3 supplements. A study of 9 randomized controlled trials found that high-dose omega-3 fatty acid supplementation was associated with a lower risk of end-stage renal disease. 5. Newer anti-diabetic drugs can improve kidney function. These drugs may also have cardiorenal protective effects beyond glycemic control. They can reduce oxidative stress and inflammation and improve mitochondrial function. For further information, management and treatment, please contact Dr. Sanjeev on WhatsApp 932375869.